Good morning, everyone. You're listening to Caregiver Crossing, a podcast brought to you by Joyous House. So blessed and thrilled that you're here. Caregiver Crossing is a podcast created just for you, the caregiver. And I'm Tina McIntosh.
Hi, Tina Bina. I'm Terry Stacy, and we are here every week with experts across the country, and we want to provide comfort and resources and joy to all of you caregivers out there. This podcast serves to embrace family caregivers of today and tomorrow, and we thank you for being here. So let's get right to it, Tina Bina.
I'm so excited for our guest today. We're talking with Stephanie Monroe, who is the Executive Director of African Americans Against Alzheimer's. It's the first national network created specifically to respond to the disparate impact of Alzheimer's on African Americans.
One of the organization's primary focus is to bring Alzheimer's out of the shadows and dispel myths about the disease symptoms, and to also encourage greater participation in clinical research. We've talked about that so much, to participate in clinical research designed to more effectively prevent and treat and eventually cure this awful, dreaded disease. So let's get started right here. Tina, you want to ask the first question of our guest and introduce her?
I do. First of all, Stephanie, thank you so much for being with us today. Good morning to you.
Good morning. My pleasure. Thank you for having me.
It is. It's an honor. You're doing such great work. And we want to talk first. There is this disparate impact of Alzheimer's on African Americans, and we're hoping you can speak to that. I know that's a really big and broad question, but can you help people to understand what that is?
Sure. So I'll throw just a little bit of statistics out there, not to overwhelm, but as many may be aware, we have about 5.7 million people who have Alzheimer's disease. African Americans, in terms of U.S. population, make up about 13% of the population, but we are 20% of folks who have Alzheimer's disease, and we're actually carrying a burden of 33% of the overall national cost for Alzheimer's. So both the prevalence of the disease is higher among African Americans, and the burden of the cost, primarily, frankly, through caregiving costs and lost income and productivity, people stepping out of the workforce. It's costing generations of income and wealth that's been built, frankly, since the civil rights era. People could have one generation of Alzheimer's and wipe it out.
I have a question about that. Sorry, Terry.
No, go ahead.
I have a question about that, Stephanie, because were you a part of getting down to those statistics, or was that done before you came into this realm?
So actually, I don't like taking credit for things, but yes, one of the things our organization did, we wanted to understand what was happening among African Americans. And frankly, I was a public policy person. I worked in the U.S. Senate for over 25 years, and don't recall people actually lobbying me on the Alzheimer's disease itself. We had, a very small line item of funding for NIH research related to Alzheimer's. But when I started digging deeper and actually being a public health person, reading vital statistics and just digging deeper into what was happening, it was very quick that I understood that there was these huge disparities in terms of deaths, diagnostics, and what was happening among African Americans. So we began to, one of the first things we did was we published a cost report back in 2013. And unfortunately, it hasn't changed much except for getting worse. But at that point is when we discovered this great disparity and the economic disparity that it was having on African Americans in particular. African Americans are about 2 to 3 times more likely to develop Alzheimer's as non-Hispanic whites, and Hispanics are about 1.5 times more likely than whites to develop Alzheimer's. And so we really have to understand what's happening so that we can find more effective treatments and hopefully a cure.
Is the needle moving? Or is it going in that direction? Are we learning more as to why there is this disparity?
We are certainly learning more. I sort of describe it as a big onion. The more we learn, the more we don't know. And you have to peel back the layer. And we know that vascular diseases, heart disease, diabetes, stroke, things like that are precursors, it appears, to Alzheimer's disease, especially in minority populations. When you start examining that and what are the causes of that, in order to really see, are there things that we could be doing to help mitigate, not prevent, but mitigate Alzheimer's, we look at food, nutrition, we look at exercise, what communities have access to. And these are generally called social determinants of health. So it really begins in the home, in the community, and then it's filtering up. We have to address some of these underlying issues in order to really get at why do people have diabetes? Well, they have diabetes because there's not fresh food where they are necessarily. The quality of food is not good, and so they eat a lot of canned goods. And in canned goods, what do we see? A lot of sodium, and sodium causes this spiral effect. So really getting down to it, we need to really start thinking more deeply. But at the beginning level, it's getting people in and getting diagnostics done on them so they can treat these underlying comorbidities that could be contributing significantly to Alzheimer's disease.
There are so many directions to go with that. Like, I can't imagine sitting in the room trying to be you, trying to figure this stuff out, because there are 1,000 different directions to go. I'm just grateful that there's an organization like yours, who is doing this work. Again, you are hearing the voice of Stephanie Monroe, who's the executive director of African Americans Against Alzheimer's. There's part of this bigger Alzheimer's movement, right? There's the umbrella of Us Against Alzheimer's. What is your relationship with them, and how have they been helpful to you in moving forward?
So we actually are part of Us Against Alzheimer's. We are a network of Us Against Alzheimer's. So Us Against Alzheimer's, if you think about it, we've got different communities where people, advocates, can decide that they want to reside there. So we have a women's network, we have a Latino network, we have the African American network. And that's a way of expressing the voices of different communities and those specific needs, but also coming together under a broader umbrella. What we have learned is that at the root of all of this is a lack of attention to brain health. So rather than focusing on disease, let's talk about ways that we can promote brain health. And how many of us go to the doctor and the doctor says, basically does an assessment of a checkup, as we call it, from the neck up.
I was just going to say, it's always neck down.
Yeah, it is. It's like the brain is decapitated from the rest of the body, but that's the organ that runs everything. So we're talking more about brain health, trying to encourage doctors to really engage your patients at a young age to find out what their base level is, so that when there's a decline, we can find it and hopefully mitigate and then treat for it.
I want to ask you, Stephanie, this is close. All of this is close to your heart. We're Caregiver Crossing. You are a caregiver. Is that right?
Yeah. When I started this work, I had no idea that my father would have been diagnosed about 5 years into my work in this space with Alzheimer's, and he's now been in for about 7 years. He's doing moderately well, but the burden, my mom is 87 and she's trying to take care of him. And it's a real challenge, for all of us. So I completely understand. The costs are enormous. The emotional strain is a burden that, a check cannot solve for, but that would be helpful.
Yeah, absolutely. Tina?
I have a quick question for you. I know we're almost out of time here, but when you go home at night, Stephanie, what is it that you think that you wish you could have done more of during the day with this work?
Oh, my goodness. I wish I could have started about 10 years earlier. Like I said, when Us Against Alzheimer's started, and we certainly are a very collaborative organization, we work with everyone in the field who is interested. We are part of a 150-member network of organizations that are serving people with dementia, like Alzheimer's disease. And when we started, the NIH research funding for Alzheimer's was around $400 million, which really may sound like a lot, but it really is not. Mm-hmm. And here we are 10 years later, and we're now over $2 billion. So a focused effort, I think, sooner may have allowed us to progress further. But we've got to do research. We've got to find treatments and a cure. The other thing that's really unfortunate is that African Americans and Latinos participate at very low rates in research, so around 3 to 5%. So the fear is, number one, that we don't really understand what's happening in these populations, and then secondly, that treatments that we actually find may not work in those populations. So we really have to roll up our sleeves and make clinical participation like voting. We need to have a campaign that we all need to contribute if we can, and there's different ways that people can contribute. Please go to our website, usagainst-alzheimers.org. And there's ways that you can look at, different ways you can participate. It could be something as easy as participating in an exercise trial, or changing your diet, or of course participating in investigational medicines that are moving toward approval.
We do need to get people to participate and realize that those clinical trials are not scary. I think people think they're scary. So I know we're pushing our time, but one more question. When you go home at night, then what is it you're most proud of with this great work?
I'm proud that I know that we have reached, even with my work, I have personally touched over 30,000 people in the United States in African American communities. And I'm hoping that they've spread the word. So, there's a lot of myths, a lot of false facts, a lot of fear, a lot of trepidation due to past atrocities like past medical research atrocities, Tuskegee and Henrietta Lacks. And we see many more people interested in participating in research. We know that 80% of people, when we asked them, because there was a feeling that African Americans would not participate in research, we found that 80% of the people aren't asked. That was the first hurdle. And then secondly, we found that when they were asked, 80% or so were willing to participate. So that's a big hurdle. And I'm glad that we've moved the needle so that people are more willing. People have now have a better understanding of what the disease actually is, what different types of research are, and things that they can do to mitigate, again, their brain health deterioration.
usagainst.alzheimers.org. Stephanie Monroe, African Americans Against Alzheimer's. You're awesome. If anything, I've learned a great deal about what you're fighting for, and I was completely unaware of the disparity. So thank you so much for joining us. On behalf of Tina McIntosh, listen, everybody, thank you for listening. Join us next time right here on Caregiver Crossing. Have a great week.